Board members and management, this is our quarterly update for January 27, 2026 for our 24 to 26 strategic plan. 5 strategic direction teams were launched January of 2024, and we have quarterly updates that are archived on the homepage of Board Effect. A board advisory policy for input was approved by the board May 28 of 2024. And as you can see, videos relevant to this strategic plan are also archived along with our presentations on the Board Effect homepage. Here's a quick overview of our 5 strategic directions featuring our teams as well as our board advisors. Strategic direction number 1, proposal A, is 100% complete. Reestablish patient-centered medical home certification, which was completed October 24 of 2024. We're continuing stringent metrics to assure ongoing best practices at all of our clinic locations. SD1B is 100% complete to improve clinical outcomes. In 2024, we started tracking 4 different measures: statin therapy, diabetic eye exams, diabetic foot exams, and chlamydia screenings. All goals were met at 100%, with a 5% improvement in metrics over 6 months. 12 quality assistants have been hired as of January 2026, up from 7, and all performance measures have been met as of January of this year. SD number 2, proposal A, expand services and service area for changing needs, 20% complete. We have completed contracting with our health plan in January of 2024, representing all of our Medi-Cal patients, and we continue to review and renew contracts to serve our patient population. SD2B is design and implement a comprehensive energy efficiency plan, 25% complete. We're collecting statistics by location on energy usage. We're going to come up with recommendations and then present cost estimates to implement efficiency measures by location as well. SD number 3, proposal A, expand the range and volume of services, 90% complete. A community needs assessment plan approved by the board November 19, 2024 was part of this process. We have expanded or created new locations throughout our 6 counties, including the Cannery Clinic in Marysville with 24 exam rooms opening January 15 of 2024, you can see, followed by North Plumas, North Chico, South Chico, an expansion for the Gridley facility, a new building for family dental and medical on Cohasset Avenue in Chico, and of course our Ampla Health Yuba City, which is located at 1000 Sutter Street on our corporate campus. Many new locations have been opened or expanded, and provider recruitment has been implemented. SD number 3, proposal B, expand on-site access to eye care services, 100% completed. Eye care, the first of its kind in our 6 counties, was started May 5, 2025 on our corporate campus. We are providing retinopathy exams for patients with diabetes, and in early 2026, we'll be conducting telehealth visits for follow-up appointments. We invited our local officials to celebrate at our Marysville Medical at the Cannery, November 5, 2025, with a ribbon-cutting ceremony. SD number 4, proposal A, engage social determinants of health to improve population health, 100% complete. 2 of these were addressed during the holiday season, starting November 15 of 2025. We saw a lack of basic supplies and clothing, and also food insecurity. December of 2025, one of our new programs, CalAIM, placed a large barrel into each Ampla Health facility location to collect items such as toiletries, clothing, as well as holiday gifts and toys. As a result, we collected 6 large bins, which provided for 150 of our patients. Also, December of 2025, the PCMH program, through Clinical Services, collaborated with local food banks to learn what was needed. We initiated a food drive for non-perishable items and then donated them to each of the food banks who expressed appreciation for our food donations. SD number 4, proposal B, assess barriers and solutions to patient use of technology, 100% complete. In September of 2025, the Tri-Counties Community Center in Marysville declined our offer for computer donations due to a lack of space and need. However, Twin Cities Rescue Mission subsequently said we'll take it, as they had remodeled a trailer for this purpose at the former 14 Ford shelter site. We'll donate 6 computer stations, and they should be set up in January of 2026. Our efforts in social determinants of health were not a one-time effort. We're going to continue this on an annual basis. SD number 5, Proposal A. Design and implement a plan to address all special populations, 75% complete. This process was to identify and commit to participating in a cultural event with prioritized populations, and also pilot test an alternate service delivery model to bridge selected populations with our clinic locations. We've done this through our Ryan White team and program, which began mentorship and monthly support groups to help HIV patients improve networking in healthcare, and CalAIM as a whole-person approach to care that addresses clinical and non-clinical needs of high-need Medi-Cal beneficiaries enrolled in managed care, represents another arm of that process as well. And as of January of this year, Ampla Health has 24 lead CalAIM case managers in both northern and southern service area models, delivering enhanced care management, providing services to over 1,400 patients. The program provides services to a number of different populations, including homeless adults, those experiencing serious mental health issues, substance use disorders, transitioning from nursing facilities, incarceration, pregnancy, or who are postpartum. We're providing similar services to our children and youth population. SD number 5, Proposal A. Design and implement a plan to address all special populations, 75% complete. CalAIM participates in the Church of the Homeless event at Chico by promoting Ampla Health and CalAIM services and distributing food to homeless populations the last Sunday of each month. We collaborate with Victory Outreach Church for the Day of Hope event, with 11 lead case managers volunteering to help distribute information, clothing, and food to over 200 individuals. We implemented CalAIM's donation drive for the 2025 Christmas holiday season across all Ampla Health locations as noted, and we distributed to 150 CalAIM patients. SD number 5, Proposal B. Continue to improve access and health outcomes through national ag worker initiatives, 50% completed. Our promotores team has 4 team members, including a lead worker and 3 promotores. We've developed a outreach toolkit to summarize our health resources, and our mobile medical clinic is visiting locations like a Yuba City Farm working housing complex once a month to provide outreach to the seasonal farm worker population. In a need assessment done by Ryan White, a report from July of 2025 has indicated a significant long-term unmet service area population need. So Ampla Health is engaged in patient consumer advisory board meetings to help fill in and to be part of the process in supporting efforts for these needs. Our next quarterly update will be April 28, 2026.